Hello, and welcome back for the scientific ethics lecture, where we're going to continue our discussion of stem cell science, stem cell therapies, and now get into a little bit of stem cell policies. And again, keep in mind that what we're talking about with stem cells is kind of an alternative to tissue and organ transplants, with this idea that the stem cells are going to allow us to generate kind of large populations of cells, ideally from the patient themselves, but potentially from some other source, which is going to allow us to, create what needs to be transplanted into patients in order to be able to, treat their medical disease. Now, one of the big concerns about stem cell policies is, it's an experimental treatment. Who's going to pay for it? Is it something that you can get health insurance coverage for? And so what we're going to look at initially is some of the kind of ramifications, some of the implications associated with health insurance coverage. And so right now, if you were to go to a doctor, the doctor is going to look at you and then fill out a form based on some type of diagnosis. And based on that diagnosis that he makes of you, there's going to be a billing system that's going to be recognized that is going to determine how much the doctor is paid, how much the doctor is able to kind of retrieve for kind of running tests and things like that. And so there's going to be a common coding system that's used in the US healthcare system. One of those very complicated names, but the Healthcare Common Procedure Coding System codes, the HCPCS, and these are going to be used for Medicare and Medicaid services. And so you can find that if you're using insurance, or if you've got coverage through Medicaid or Medicare. Related to that is the current procedural terminology, the CPT, which is created by the American Medical Association. And so basically, these two common coding systems are going to be related to one another, and the doctor is going to be reporting on the diagnosis and what they're doing with you to the insurance company based on one of these two coding systems. Now, if we take a look at it, what we have in the United States is primarily a third-payer system, and so we're going to have a situation where some individuals may pay out of pocket, but the majority of the individuals are going to have insurance that is either provided by the government, something like Medicare or Medicaid, or have private insurers. So they sign up for, Blue Cross Blue Shield or some other provider, and so they pay a healthcare premium, usually monthly, to the insurance provider, and the provider is going to provide them some coverage. So that if they go see the doctor, or they have to get a prescription filled, or something else is going on, they're going to get, some money back. They're going to get the insurance covering, hopefully, the procedures that they're looking at. And so if we take a look at it, what's going to be occurring, and the decisions made by both the government and the private insurers, is they're going to look at it and say, okay, is the procedure approved for reimbursement? And so basically, is it an approved kind of standard of care for the treatment of whatever condition that you may have? And then they're going to ask, is the procedure medically necessary? So is the doctor prescribing a test or prescribing a medication that's going to give them more information about the condition that you have? Or potentially, is it a medication that's been approved for the treatment of your condition? And there are often other factors involved as well. Do you have a limit on what you're able to get? Is there a cap for, your annual benefits or lifetime benefits, kind of things like that? Again, because both of these, the government and the private insurers, are going to be bringing money in, but they don't have an unlimited pool of funds. And so at some level, they have to restrict what they're going to be paying for in order to be able to provide the coverage that they're issuing throughout their insurance. Now, when we start adding in clinical studies, especially when we're talking about kind of experimental medicine, and stem cell science is a new and emerging therapy, and so in many cases, it's not approved as a standard of care. Stem cell treatments aren't approved as routine. You can go in and say, okay, I want stem cell therapy, and the doctor's going to give it to you. In many cases, even though some uses of it, primarily for the treatment of blood diseases, has been approved, many of the other ones, in order to be able to get access to this, at least within the United States, is to become involved with a clinical study. And so what we need to do then is say, okay, what are the costs to the patient that is going to be involved with the clinical study? Because they're not going to pay for everything themselves. The insurance company may not pay for everything. And if we take a look at the sponsor, the person that's putting on the research, either the funding agency or the pharmaceutical company or whoever it is that's doing it, again, they're going to have limited funds available to them. And so what you're going to see within a clinical study is that in most cases, the clinical study is going to have money set aside, which is going to cover the experimental drug or treatment. And so if you're going to be getting an experimental drug or experimental stem cell therapy, all the costs for that drug or for the therapy are going to be covered within the clinical study. So you're not going to have to put out regular funds or insurance funds to participate in the clinical study for that. If there are tests being done solely for research purposes, that again is going to be provided by the sponsor. And so if you're getting a stem cell transplant, and what they want to do is kind of monitor where the cells are going to be located and kind of ensure they're not forming a tumor or something like that, you may go back for some type of imaging. So you maybe go back for an ultrasound or a CAT scan to just kind of assess where those cells are that have been transplanted in. And so that test, the ultrasound or the CAT scan, isn't to kind of look at the disease, it's to look at whether or not the stem cells are doing what they need to do and what they're being tested within the clinical study. So that's going to be covered within the funds provided by the sponsor, provided by whoever's doing the clinical study. But generally, the clinical studies aren't going to cover other routine medical costs that are associated with the condition. So if you're on kind of a regular medication that you're taking, monthly, taking it every day for, in perpetuity, the clinical study is not going to cover the medication. If you need, blood work taken every 3 months to monitor your condition, in most cases, the clinical studies are not going to do that. And so again, the clinical study is going to provide kind of the experiment and the experimental drug or treatment and what's needed to kind of test whether or not that experimental drug or treatment is having the effect that they're trying to investigate. Now, if we take a look at the other side, and so your current health insurance policy, and that may be, again, the Medicare and Medicaid, or your private insurance through your employer or through your family, or if you go into the Affordable Care Act clearinghouse, you can go through and get insurance that way. Basically, what they're going to be doing is they're going to be doing whatever is the recommended standard of care for whatever condition you have. And so going back to those codes we started out with on the first slide, what's going to happen is they're going to look at, say, okay, based on this diagnosis, this is what we approve for the treatment of that condition. And so they're not going to approve an experimental treatment. And in most cases, they're not going to cover off-label uses of a specific drug. And so if there's a drug that has already been approved by the FDA for treatment of another disease, and your doctor is interested in using it in you because there might be, a benefit to you in doing that, it's often difficult to get that approved by the health insurance because they're going to say that this isn't the standard of care. This is something that, we don't have a lot of evidence that it's going to be helping our patient, and therefore we're not going to pay for something that may not be helping them. The problem with this then again becomes, what happens with you have a disease or a condition that, the standard of care is poor, and you want to try one of these experimental drugs or try one of these new off-label drugs. Again, an off-label drug approved for something else, but it's being used in your case to treat your specific condition. And so because of that, there's a lot of controversy about whether or not they should approve something or whether or not it falls into that experimental category and they can exclude it. And part of that problem is that the definition of experimental is difficult and varies from one insurance provider to another. Generally, the kind of standard is that it's approved by the government regulatory body And so if you're involved with a human study, there's going to be a clinical study that's registered with the government. And I think I used that in one of our previous lectures. And so it's been reviewed and approved as being something that, even though it's not approved by the FDA as a treatment for the condition, at least there's some evidence, and the people that are regulating and overseeing clinical studies are saying there's enough evidence that says that it may be, involved with that. And so, we got something going on, normally based on some scientific evidence or a number of procedures that have been done, saying that, it's possible that this could be helping. But again, we don't have clear and convincing evidence that we could take to the Food and Drug Administration and have this added to the standard of care for treatment of disease. And so because of that, then we often end up with a conflict where a patient wants to be involved with a clinical study or use a medication off-label with the advice of their physician, and the insurance company may not pay for it. And we can see if you can get into a clinical study, the clinical study is going to cover some things, but not necessarily other things that are needed for the treatment of your disease or condition. And so because of that, again, I'm looking at Medicare on this slide. Medicare currently covers treatments that are reasonable and necessary. So those are the things that standard of care that's considered safe and effective by the FDA. But the government providing Medicare and Medicaid as a government-supplied insurance recognizes that there's a little bit of a disconnect between what we want to do in promoting patients to be involved with clinical studies so that we can improve care going forward. Medicare, about 20 years ago, in an executive memorandum, authorized Medicare to pay for routine patient costs. So those are the other kind of treatment things associated with your conditions, the normal standard of care, the things that are not covered within a clinical study. But they also added in, they can add the cost due to medical complications associated with the participation in clinical studies. Now, hopefully you're not going to have any medical complications, but by adding this clause in, it means that patients that are on Medicare or Medicaid can participate in clinical studies and have a lot of their other costs covered by the insurance. Again, even though the cost for the experimental medication or the experimental treatment is going to be provided by the person that's doing the clinical study. And so again, there's a lot of confusion. Will Medicare cover a clinical research study? The original Medicare, and this gets really confusing when you start talking Part A and Part B. Part A is basically your hospital insurance. Part B is your medical insurance. So Part A is going to cover if you're in a hospital getting a surgery, or you're there overnight for some type of procedure. Let's cover the medication, the doctors, the hospital visit, all of that. Part B is your standard medical insurance. So that's going to cover your normal doctor that you're going to go and visit on a regular basis, probably cover your medications, cover your tests for things like that. And so basically the question is, will Medicare cover the costs associated with a clinical study? And again, with that caveat that was added in here, this executive memorandum, Medicare Part A and B are going to cover the routine costs associated with your treatment, whether or not you're within a clinical study. And so it's going to cover things like room and board in the hospital, your Part A over here, if Medicare would pay for it, even if you weren't in the study. Possibly, it could include an operation to implant the item that's being tested if there is a standard of care for there's an operation that could be used for the treatment of your disease. And then again, with that caveat, it's going to treat the side effects and the complications. These things are normally going to be covered under Medicare Part A or Part B. Now, having said that, it doesn't necessarily mean that the paperwork's going to be submitted or they're going to pay it the first time. Often people are going to have to challenge that and ask for a review, when the doctor's got to be proactive and become involved in order to ensure that you get coverage. Again, many insurances require a pre-approval for things, or at least kind of deny things the first time and review it a second time before they approve it. Now, Medicare generally won't cover, and so these are things that aren't going to be covered under most circumstances for Medicare. The new item or service that the study is testing. And so this, again, will normally be covered by the study provider. But there is the caveat that if the item of service is available to you and you were able to get it within the normal standard of care, Medicare may cover it. Items and services that the study provides for free. So they're not going to pay the study sponsor to do the study. Medicare is going to cover the things that they're going to cover, and whoever is providing the funds to support the study is going to have to cover the other services within the study itself. So this is providing for the medication that's being tested. This is providing for possibly the imaging tests or the blood tests that need to be done on a regular basis to kind of assess whether or not this experimental treatment that's being studied within a clinical study will have the effect that you're going to be wanting to study within the experiment. Normally, Medicare won't cover items and services that are only used to test whether or not this experimental treatment is effective. And so the example of this, if you're a condition that normally you go for a yearly EKG to take a look at your heart pattern and make sure everything is working fine, if as part of this clinical study, they want to evaluate you on a monthly basis and look at your heart, the clinical study is going to have to pay for the monthly EKGs, and the Medicare will only pay for one a year, because that's normal standard of care. Now, when we take a look at this, that's for Medicare and Medicaid, but many people have that third-party payer. They have that private insurance. And so because of that, routine patient care costs are not consistently covered once a patient enrolls in a clinical study. And so many states then have their insurance providers have the ability to decide they're not going to continue to cover your condition if you're involved with one of these clinical studies. And so to address that, these states in red are, hopefully get this one right, I can barely read it over here. The states in red have clinical coverage so that they will continue to provide, again, those routine costs when the patient registers to participate in a clinical study or a clinical trial. But again, that is something that you want to be aware of if you decide, or somebody in your family decides that they want to become participating within one of these clinical trials, because it could be very devastating to find out that your insurance has been pretty much suspended because you're involved with a clinical study. It's not going to cover the things that it normally covers, and that could put a patient in a very bad situation. And again, this is an area that we're continuing to look at to improve it, because we want to improve medical care. We need to be able to do these clinical trials, but we don't want the expense to be borne by the patient. We need to come up with some type of good compromise and balance between the third-party providers, either Medicare or Medicaid, and the private insurances, and the people doing the clinical trials. So that's going to give us kind of an overview about at least the healthcare coverage, the insurance coverage associated with stem cells. Come back for part 2, where we're going to look at some additional legal rules related to stem cell usage. As always, if you have any questions, feel free to email me. Thank you, and have a great day.